Hi everyone, Dr. Cary Yurkiw here. Thanks for joining me today. Thanks for joining me and Luca today as I record this webinar in the evening here in the clinic. And today I wanted to talk about how to fix foot, knee, and hip pain naturally. And a lot of people suffer from foot, knee, and hip pain. It's something we see a lot in the clinic. We're going to talk about our approach to helping with these conditions. So why does lower body pain happen? Well, they're often related. So for example, somebody puts their hip out, the knee compensates, maybe the other side is taking more weight, and it starts to create other problems. Not only is the hip sore, but the knees become sore in the feet, and it alters your gait, the way you walk. Causes can be poor posture, footwear injuries, overuse, even misalignments. So in the next slide, I want to talk about the body in motion, functional alignment, and explain some biomechanics to you. For the body in motion, for functional alignment, I'm talking about biomechanics, the way you walk and move. If you move symmetrically, your body's in the right alignment, the weight will be distributed equally on the right and the left side of your body. But if you're crooked or sloped, like this person with their shoulders, they're going to be putting more weight on the left side than the right. Could lead to wear and tear on the shoes, uneven wear and tear. Could eventually lead to uneven wear and tear of the joints on one side versus the other. So this can affect your knees and your hips, your spine, and your feet. So we want to talk about those sprain and strain injuries. We also want to talk about osteoarthritis and how that can develop over time because of this kinetic chain. So real world symptoms that we see are conditions like plantar fasciitis, like heel spurs, metatarsalgia over here, Morton's neuroma, pinched nerve in the foot. We can also see bursitis in the knees or the hips. We can see overuse injuries where you're getting pinched nerves in the low back or sciatica going down your leg. So as a chiropractor, once we assess the person, we want to work on joint realignment. We want to work on adjustments that realign the body, improve the balance and the function, take the pressure off the nerves, and improve the muscle tone so it's equal on the right and the left side of the body, the front and the back. We also use shockwave and laser for soft tissue healing. Shockwave, there's sound waves that go into the body. Laser is light therapy that goes into the body. Those two treatments help to heal soft tissue. So if you've had old injuries, scar tissue, these techniques that we use in the clinic can really help those tissues to heal faster and better. We also do orthotics in the clinic. These are custom-made inserts, and these custom inserts correct the posture of your foot. So it really helps with the alignment of your foot posturally. And this can prevent things like plantar fasciitis, which is stretching of the bottom arch of the foot. So if you have the right arch and the right alignment of the foot, you're going to get that spring in your step. But if the arches are falling, if your foot is kind of falling in, like pronation, then that's going to cause problems in the foot. So we want to cushion the foot or put in some shock absorber into the orthotic, but we also want the corrective element to the orthotic as well. So when should you seek treatment? What are the green, yellow, and red flags? Well, some of the green, yellow, and red flags are things like symptoms that just develop periodically. Like, for example, if you strained your foot on a run, but the next day it's gone, it doesn't come back, I would say that no problem there. It just might be a temporary sprain. But if that feeling comes back, it's starting to happen on a regular basis, let's say weekly, then that's a yellow flag. That's something that you should be paying attention to and seeking some treatment before it gets too late. And The red flag, when the pain increases, it's getting hard to walk, it's affecting your function, I would say that needs immediate attention, time to go see a health professional like a chiropractor to find out what the problem is. Who benefits most from chiropractic treatment, shockwave, laser, and orthotics? Active people like runners, nurses who are on their feet and lifting and bending a lot, aging adults that are starting to lose the fat pad on the bottom of their foot and need more cushioning. These are all good examples of people that could benefit the most. So for you, take a look at the bottom of your shoes, how your shoes are wearing. Kind of do a self-analysis. Are there any pain or symptoms that you're experiencing? How often do you experience those, and what's the intensity of those symptoms? Stretching is always good. I like to give back stretches, hip stretches, knee, ankle, and foot. There's different ways you can do that. Here I have an image of a band, and one of those exercise bands. This is more for resistance than it is for stretching, but it can be used for stretching as well. And so it just depends on which tissues need to get stretched. And that's really important, is identifying the tissues that need to get stretched the most. And then we want to do postural checks. We have special technology in the clinic, an app that allows us to measure very accurately how you're out of place. It actually gives us measurements, quantifies it, and even degrees of how much you're out of alignment. So really good way to do an alignment-based postural checkup here in the clinic. And something else you can do is get out there and start walking more, get more active, and just see how you feel. You know, with the increased activity, are certain warning signs getting worse, and do they need immediate attention? Now, what did the results look like? Well, most people heal 2 steps forward, 1 step back. So they come in with pain that's, let's say, an 8 or 9 or 10 out of 10. We start to do treatment, goes down to a 5 or 6, then back up to a 7 or 8, down to a 2 or 3, back up to a 5. You get the idea. So the pain will wax and wane as the treatments progress. The function increases and the alignment improves as the treatments progress. It's kind of like going to the gym to get stronger. Increased mobility will lead to less pain and better energy. So that's very important. We want to make sure that people are able to do more and they can do the things they love to do again. And you want to set realistic expectations. I try to do that with my with my patients right from the start. So I like to talk about what you can expect in the first week, the second week, third week of care, so they know what they need to do to help themselves, as well as they can kind of monitor their progress. So if you want to come into the clinic and you want to get a checkup, what I'm going to offer you today is a 15-minute free consult. We can do this online we like to use Google Meet. So all you have to do is book that appointment. My staff will reach out to you, set up that Google Meet call. We will talk about your condition, some of the obstacles you face, the goals that you have, and see what we can do to help you to get out of pain. If you know you need care, you want to come into the clinic and book an appointment for your initial assessment, you can go right to our website, tutstreetfamilychiropractic.com, or you can call or message us at 250-486-0062. No referrals needed. We offer direct billing, and we do have appointments available 7 days a week, including weekends and holidays. So the final takeaway, one area affects the others. So when you have pain in your back, that can cause hip pain, it can cause knee pain, it can cause foot pain, and vice versa. So it's a kinetic chain, and one area can affect others. It's very important to get your posture checked, your gait analyzed, so that we understand where the problem is coming from and can make the right adjustments to help you with your condition. And today what I have to offer you is a pain-free free booklet for your lower body. So I do have a handout for you. If you're interested in that handout, you can type in the comments free booklet. You can type in the chat here on YouTube, or you can DM us on social media. We'd be happy to send you that booklet for you to review all of the things that we talked about today, and then some more in-depth information to help you. I want to thank you for coming today. If you want that code, here's the QR code that you need. You can just scan that using your phone, and then it'll go right to our website, and then you can book your initial 15-minute consultation for free. This is for a limited time, so this QR code may only work for a short period of time. I'd encourage you to use this as quickly as possible, and I hope to see you in the clinic soon.